You know, when we start to implement all these little things back into looking at a bigger picture of a small area that might be hurting, we actually can help to promote long-term change and actually create something that's not going to just keep coming back time after time after time. Welcome back to another PT Pro from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we're talking about biceps tendinitis. What is it? How do you know if you have it? And how can you really start to treat it? We're going to talk all about it.
Biceps tendinitis is another one of those itises, another one of those tendon inflammatory injuries that we're learning as they become more chronic, they become less inflammatory. And so we're going to treat it fairly similarly to that. And we'll talk more specifically about the exercises and what we're supposed to do later on in this YouTube video. But if you've been loving this, or if you've ever seen these before, or if you want more information on different injuries, body parts in the future, go click that subscribe button quick, or maybe hit the bell because that's going to alert you. I point and I act like I know where these buttons are.
Yeah, I have no idea where I'm pointing.
We should probably figure that out. But subscribe and you'll get alerts in the future when we come out with new PT Pearls and when Jen comes out with her YouTube videos as well. All right, let's get back into biceps tendinitis. There's always inflammation going on. And I think what we start to realize is that it's the chronic presence of that inflammation and then the chronic degeneration or misaligned healing of that tendon that results in this more chronic condition, which we would call a tendinopathy or a change in the tendon.
So when we're talking about treating biceps tendinitis, we have to be thinking about the degeneration of that collagen that happened in the tendon and how do we start to regenerate that and rebuild so that it ends up being stronger. So when we're looking at like who this commonly happens to, it's really in that younger athletic population, a lot with overhead activities. Surprise, surprise. Baseball, volleyball, softball, anything that's kind of throwing overhead and going into that flexion. And then we're kind of slowing down into that hand turning under, which is called our pronation. And that bicep actually does flexion of the elbow, so bending the elbow in, but it also rotates that forearm up to the ceiling or that hand up.
Supinates.
But you had biceps tendinitis a little bit.
And I think it's really indicative of what we were reading about how this comes along a lot with like rotator cuff injuries or rotator cuff itises or inflammation. I was a catcher in baseball, so I'm throwing sometimes up to 100 pitches back to the mound every game or a couple real hard ones down if I'm throwing down to second base. And you'd wake up the next day and you'd say, oh man, I just had throbbing from all the way around my shoulder. And then you get this pain kind of in the front of your shoulder because your biceps, it actually attaches two places. That's why we get the bi, because there's two heads of the biceps. One of them attaches on this long bone on your arm called your humerus or your upper arm, and then the other one attaches all the way kind of at the top of your scapula, actually, kind of where the ball of your humerus or your arm goes into the shoulder blade.
That's where we're really looking at that long head, that long tendon of that biceps that's crossing not only just up into the upper arm, but it's actually crossing that shoulder joint.
Our body is responding to all the inflammation or the the load that's put on that tendon, and it's saying, hey, we need more tendon here, but it just doesn't have time or the right messaging to build that tendon in an organized manner. So if we imagine our tendon as a bunch of these threads all sitting in one line with each other and working and sliding past each other nicely, as that tendon thickens, like just imagine like the meshing of a basket or something where they're all kind of disorganized and going in a different way. How do we start to give that tendon a different message to lay down a little bit differently? You'll also see things like this in working populations, anybody who works overhead, painters, manual labor, any different type of manual labor that you're carrying things a lot, working overhead, needing to throw things, working on a farm, tossing hay bales, anything that's going to add that load and have you using your arms with any sort of force or velocity.
You can get that pain in the front of the shoulder. It can also feel like it kind of radiates down toward the elbow, especially when you're getting that constant pain, that constant irritation. So you kind of, yes, it's right in the front, but it can kind of come down. It might even be associated sometimes with like clicking or popping noises, especially if we have some instability around that whole shoulder girdle. So the shoulder blade and the shoulder itself, maybe we're having some instability, we're having some pain. So all of these things kind of, if you're having these symptoms, more pain at rest, maybe you get more pain at night. All of these can be indicative to kind of having this bicep tendinopathy happening.
All this stuff is great. Yeah. What the heck do we do? And
rest, ice, and
rest, ice, and throw a laser on it. No, we do want to control pain.
Yes.
You know, that's always kind of the caveat is like, we do want to control pain as we start to try and reintroduce the stimulus that's going to help this tendon build in an organized manner and get back to doing the work it should do without having such a dramatic pain response.
Just looking at like complete rest. We are looking at activity modification. So how can I modify what I'm doing a little bit in order to reduce some of that tension and that pain? So we want to keep moving, but you also don't want to push through pain. You don't want to push it too extreme.
I think it's okay to use some different things like manual therapies, like dry needling. I mean, heck, throw some heat and cold on there. We have episodes on those and what they actually do, and they actually can be very powerful pain modulators, but you just shouldn't be using that as the sole like pain modulator or after the activity if you're still getting a dramatic pain response and then you're using massage or cold or heat to deal with that pain. That's not what we're talking about here.
Right, because that's only working at the symptom level. That's putting the Band-Aid on it. First of all, when we're talking about tendon reloading, that's how the tendon heals. I think ultimately is what we need to take away from this, right? Is that it does heal from loading, but proper loading. So we initially want to start with what we call isometrics, which is just not moving in the muscle. It's holding tension at one steady state. And we want to think about this in a mid-range. So you're not pulling a weight all the way up and holding in a super contracted state, but maybe we're doing a bicep curl at a mid-range and maybe even to take pressure off of that supination, that rotating the forearm up. We're doing it more in a neutral position where your palm and your kind of like your thumb, your pointer fingers up toward the ceiling, and you're holding a weight or resistance band or pressing from your own hand, kind of holding that tension to what feels like it goes, you feel it, it elicits like a little bit of symptoms, but it doesn't go over that 3 or 5 marker.
Absolutely. And isometrics, like you mentioned, can be done in many different ways.
Yeah.
And then even like, okay, that starts to become easy. You're doing a set of 30 seconds, 45 seconds, 2 or 3 times, a day. Now maybe we do go into that supinated position and then try it. See if that does anything different. And then you can try at different angles. Maybe you're not right at that 90. Maybe you're going a little bit more extended, maybe a little more flex. When you do these isometrics, they do a couple things. It has an analgesic response, meaning that it helps with pain even more as we comfortably load in that 3 to 5 pain range. Even though we're only doing isometrics at 90, there are studies that show that it will help with building strength within like a 10-degree, radius on either side of that. So you're not only technically training in that 90, it's going to be giving you results in a little bit more of an arc.
And then as we start to progress from there and you're starting to feel better, you feel like, okay, my pain is going down. I'm feeling stronger in these positions. I'm feeling like I can lift a little bit more weight at a steady state. Well, then we go into that eccentric phase. So this is the loading in a lengthened position. So that means, and this is so easy to think about with the bicep curl, right? So I'm going to hold a weight or a resistance band. Again, you don't have to start with a heavy weight. You just like, could be a resistance band. And that weight or what Dom is doing and kind of showing for those listening is he's putting pressure from his other hand, putting pressure as he lowers into that extended position. So that is the load that you're getting in that lengthening. And then especially if you do have a weight or resistance band, use that hand to then help it back up. So you're not working on that concentric contracting phase. You're only working on the load and controlling down in that lengthening phase. And they say to do this for at least 1 or 2 weeks, which for some can feel like, I just want to do bicep curls. I just want to do the full thing, right? If you allow yourself time to actually start to build this up, you might notice that you are progressing in weight and it doesn't feel as painful. It's not giving you as many irritations, so that when you go into like that full bicep curl, or maybe that full bicep curl in different ranges with your shoulder a little bit higher, you're going to get less tension, less pain, less pressure, which is how we want to progress with this tendon.
People, it's like, okay, well, I can't stop working, and it seems like work is the thing that has elicited my symptoms. If you just implement 1 or 2 of these things, whether it's, hey, let's do a few sets of these isometrics and then maybe do 5 reps of eccentrics at morning and at night, then it will just start to give you that patterning, and it'll give the tendon the loading to be like, okay, let's start laying down collagen and tissues a little more intelligently. And you might even notice that that makes the difference, and you change nothing else at work. Same with an athlete, someone who pitches in baseball. Like, I'm thinking of friends of mine who just, their arm is chronically sore. Their arm is always, sore. They get to their next start, where you're supposed to have about 4 or 5 days rest, and they have that rest and they get to the next start. They're just like, oh, well, let's go for it, Where if you just implement a couple of these things, it might make the difference.
First, you want to get higher reps. So higher reps, lower load. So if you're going into that full motion, can I do 15 at a lower load? And then, okay, that's starting to feel okay. Now let's do 10 reps. Maybe I'm doing 10 pounds rather than 5 pounds. So you're kind of like progressing in that manner, in that state. Maybe you're trying to do it when you're bent over a little bit and your arm is a little bit further out, or you're just trying to get into different ranges of motion, getting that arm a little bit higher overhead, you know, to try to start to load that tendon in a more flexed overhead position, which is where people are usually getting hurt. And then the last step from that is working on what we call plyometric. So this is, you could do this with throwing a ball. You could do this with just little ball tosses against a wall. That's a pretty popular one.
There are some deceleration exercises where I've seen someone, they'll throw a ball and you need to catch it and decelerate your arm, or throw a little weighted whatever. Dumbbell would be a little bit dangerous, but I've seen people do it with dumbbells.
They have little weighted balls.
Or
probably
filling my friends always used to do this. They'd fill like a Gatorade bottle with sand, and they'd use that as like a different little thing to do some exercises with their arms. So because we need to talk about everything else that plays into and puts impact on the biceps, which is anything that touches your shoulder blade. Because that's where your bicep tendon is attaching into. So first and foremost, doing shoulder blade control stuff, because if your shoulder blade is all over the place, that's going to be having a big impact on that long head of the biceps. And so making sure we're doing shoulder retraction, protraction, elevation, depression, understanding how you can move those shoulder blades and how that shoulder blade is acting when you're doing that activity, when you're working, when you're pitching or playing volleyball.
Yeah, exactly. We also want to make sure that we're not so tight in the front of the chest. So like Dom said, anything that connects into that shoulder, right? That's your pec. Like a lot of people are on your phones. Even if you're in school or you're an athlete or you're working, maybe you're working at a desk, but then also doing manual labor. I mean, that's all forward position. So are we doing things to open up the chest and reduce that tension and pressure in the front of the pecs as well? Are you working your entire pillar from your core, right? Like that's something we talk about a lot in our programs, is our core is not just our front of our abs, right? But it goes all the way from our shoulder blades to our pelvis. And so how are we controlling our trunk in exercise, in range of motion? I mean, even if you're just going into planks and you're pressing as hard as you can from your shoulder blades without rounding in the back, that is a scapular exercise, a core exercise, and it's getting kind of that entire tissue without putting as much tension actually on the front of the chest. We're trying to push a little bit more from the shoulder blade. We're trying to use the entire front of your trunk to help assist. So, you know, when we start to implement all these little things back into looking at a bigger picture of a small area that might be hurting, we actually can help to promote long-term change and actually create something that's not going to just keep coming back time after time after time.
Thanks everyone for tuning in for another PT Pro from the Optimal Body Podcast. If you love that or have had any biceps or shoulder issues yourself, comment below. Let us know what you think. If you think it was biceps tendinitis, or if you've been told it's something else, because maybe we've already done an episode on that, or maybe it's going to be something we can do in the future. Click the subscribe button, hit that bell, and we will see you next time.